Hi, Dr. Harrison here, and today we're going to talk about headaches. Headaches are probably one of the top 2 or 3 complaints that we see in our office, and there are several different types of headaches, and I just want to relay this information to you so that maybe you can categorize yourself, kind of understand a little bit better about what's generating your headache and how we can go about helping you with them. The most common type we see in the office are muscle tension headaches. Typically, this is going to involve pressure around the head and neck, usually due to tension in the muscles that's created by stress over time. They can range from mild, and they can be actually pretty severe at times. Usually not as bad as a migraine headache would be, and we'll talk about those in a few minutes. But muscle tension headaches are typically not as strong as a migraine. Just a little bit different symptomatology, and again, we'll talk about migraines in a moment. But when we're dealing with these patients, usually it's a pretty quick fix. We'll find usually a lot of tension up at the base of the skull. So sometimes just some gentle stretching will alleviate these headaches pretty quickly, sometimes while they're even on the table in the office. Sometimes we'll find restrictions in joint mobility in the neck, and so we'll need to get in there and mobilize those joints to help relax the muscles to alleviate that tension so the headache will go away. So the great news about muscle tension headaches is they're very treatable, and they do make up 90% of the headache population. So that's number one. The second type of headache are cluster headaches, and cluster headaches are recurrent headaches that come and go in groups or cycles, hence the name cluster headaches. So you might go a week or a month without any headaches, then all of a sudden, several days in a row, you'll have a cycle or a group of headaches. This is more common in men than women, and usually when they hit, the headaches are pretty severe, and usually they'll hit one side of the face or one side of the head. And usually with that, on that same side, you'll get a watery eye, you might get some sinus congestion, and again, these are pretty severe headaches. Usually they're going to interrupt your lifestyle where you just want to lay down. The etiology of these headaches is really unknown, but the good news is these headaches too respond pretty well to spinal manipulation and working on muscle tension in the neck. So we get in and stretch you out, we check the mobility of the neck joints. Usually if we do these things and get things moving and the muscles to relax, we can alleviate a lot of these headaches. I'll be honest and say there are times where it does not. And in those situations, we can refer you out for medication if it's needed. But always best to try the natural approach first. So number 2 is cluster headaches. Number 3 are sinus headaches. Almost everybody has had a sinus headache at one time or another. Maybe you had a sinus infection, a bacterial infection, or a virus. And these can obviously drive some inflammation in the nasal cavity or in the sinus, and it's going to create a headache for you. Good news is, same thing as the prior 2, we get in there and do some mobilization in the neck. That tends to work pretty well sometimes, relieving the muscle tension that comes along with it. I've also had great success using acupuncture in the office for sinus headaches. Usually, we put the needles in, we wait about 20 minutes, and a lot of people get relief right on the table. We do have some natural products that you can take if you suspect a bacterial infection instead of taking an antibiotic, which sometimes can be hard on the immune system long term. We have a product called Bactrex, that's Bactrex, and that can be found in our store online. And just go ahead and visit there, and if you want to try that out, sometimes that'll be enough to knock out that bacterial infection. If that doesn't work, obviously you can always, as a last resort, go to your medical doc and get some antibiotics. So that is sinus headache. Let's move on to the next one. And the next type of headache is a rebound headache. Rebound headaches are headaches that occur when you're taking yourself off of medication. So maybe you've been on prescription painkillers or even over-the-counter medications for inflammation, that type of thing. And you've been on this stuff for a while and you pull yourself off of it rapidly, and you'll get a withdrawal or what we call a rebound headache. Sometimes this is something that you just have to work through as the medication works its way out of your system. Usually these headaches will just abate and then they won't come back. In the meantime, if you're having tension, again, we would check mobility in the neck, check for muscle tension, anything that's there, we may be able to alleviate some of the symptoms associated with the rebound headaches. And then last, our migraine headaches. And migraine headaches are headaches that last anywhere from 4 hours to 72 hours. When they label you as being a migraine patient or you're known to suffer from migraines, you've had at least 5 of these types of headaches. Usually they're pretty severe, a throbbing headache. Many times it'll come with nausea, sensitivity to light or sound, and usually people just need to go lay down, maybe in a dark room with no sound around, usually is beneficial for them. And many times migraine headaches will be preceded by what they call an aura, where the patient can just kind of sense they have a weird feeling that maybe a headache is coming on. So they sometimes will get some forewarning. And for those patients who have had migraine headaches, they know that because that's when they rush to take their medication, whether it's Furacet or some other medication that their doctor may have prescribed for their migraine headaches. Good news is we've had great success in the office treating migraine headaches using joint mobilization and muscle relaxation techniques in the neck and shoulder area. In my opinion, a lot of these migraine headaches, either they've been misdiagnosed and maybe they are just a severe muscle tension headache, or they just happen to be a migraine that responds very, very well to chiropractic care. So these are the 5 major types of headaches that we see in the office. If you have any questions at all or you'd like to be seen, call the office 407-522-5858. We'd love to help you and see what we can do to alleviate your headaches. Hope this has been helpful. Have a great day.